Hypoparathyroidism is a rare endocrine disorder that is characterized by having both low PTH levels and low calcium at the same time. Approximately 78% of the cases of hypoparathyroidism are caused by neck surgery. The rest are caused by either a genetic condition or autoimmune disorder. Most patients that have hypoparathyroidism experience tetany or severe muscle cramps, including laryngeal spasms, which make it difficult to talk and breathe, paresthesia, which is like pins and needle feeling. They experience brain fog, and long term, the patients can experience things like heart attacks, seizures, kidney failure, and calcium buildup in both their soft tissues of their eyes, brain, and so many other parts of the body. The current standard of care for hypopara consists mostly of just taking over-the-counter calcium supplements and vitamin D. And neither one of those tend to keep patients' calcium very stable. They treat the symptoms, but not really the underlying condition. It's kind of like putting a Band-Aid on a wound that actually needs stitches. Currently, there are no FDA-approved treatments for hypopara. Up until about 2.5 years ago, there was an actual treatment on the market in the form of Natpara, which is a once-daily injection of PTH hormone. Unfortunately, this drug was recalled due to safety concerns, and for the last 2.5 years, it's only been available to approximately 400 of the 100,000 patients via the special use program. This leaves a lot of patients who are suffering to have a poor quality of life, and in some cases, patients are on disability, and a few have even died due to the lack of treatment. There are 3 drugs in development. One is from Ascendis, one is from BridgeBio, and one is from Amolet, and they all would make an effective treatment available for hypopara patients again. And with a safe and effective treatment option, patients can better manage their hypopara and have an improved quality of life. It is crucial for the FDA to prioritize reviewing and approving one or all of these treatments to give patients possible options and relief. Conventional therapy only attempts to alleviate some of the symptoms, and the calcium supplements themselves are what cause some of the long-term side effects of this disorder. Voters' Voice is a digital tool that helps the association help patients to write to the FDA and members of Congress to communicate their experiences and share the struggles we face every day. The Voter Voice campaign is an effort to build off FDA listening session we did last year, where the FDA encouraged the Hypopara Association to stay in communication and share our patient perspectives. We're at a critical point in the development of the treatments for hypoparathyroidism. Members of Congress who represent our voices before the government need to help us communicate the needs of the community to the FDA. Thanks to an ongoing FDA commitment to place the patient at the core of the drug development process, people living with hypoparathyroidism have an opportunity to tell the FDA and their members of Congress what it is like to live with this disease. We need to let them know we are suffering without a treatment, and we need to ask the FDA to do everything they can under existing regulations to get these products approved as quickly as possible. Our voice and the engagement is critical to the drug development process and hopefully us having treatment options. Go to hypopara.org and then advocacy campaigns and let your voice be heard.